How ulcers begin without warning. It starts as a whisper, a vague discomfort in your belly, a small burn after skipping breakfast, or a gnawing ache late at night. It feels manageable, maybe just something you ate. But what if that small twinge is actually your body's cry for help? Ulcers. Most people hear the word and immediately think of stress or too much spicy food. But ulcers are not imaginary. They are not emotional symptoms. They are physical wounds, real damage inside your body that can change your life or end it if ignored. Let me walk you through a scenario. You're a healthy adult. You work hard. Maybe you pop a few ibuprofen now, and then for your aching knees, you skip meals, drink a little too much coffee, and deal with more stress than you'd like to admit. This is a normal life. But beneath the surface, your stomach lining is under siege. What most people don't realize is that ulcers form slowly. The stomach is naturally a hostile environment, filled with hydrochloric acid strong enough to burn through skin. Your stomach protects itself with a special mucus lining. But when that protection is weakened by stress, medication, bacteria, or bad habits, acid starts to eat into the tissue. The result? A peptic ulcer. And it doesn't always hurt. Let's talk about the most overlooked cause, H. pylori, a bacterium that lives in the stomach lining of more than 50% of the world's population. Most people don't even know they're infected. H. pylori lives quietly until one day the inflammation it causes begins to wear down the stomach's defenses. You don't feel it until it's too late. Then there are NSAIDs, those common over-the-counter pain relievers like ibuprofen, aspirin, and naproxen. Millions take them every day. But these drugs reduce the body's ability to produce prostaglandins, compounds that help keep the stomach lining healthy. Over time, this makes your stomach more vulnerable to acid and ulcers. Let's not forget lifestyle. Smoking reduces blood flow to your stomach, slowing healing. Alcohol increases acid and damages cells. Skipping meals or eating poorly creates stress on your digestive system. Combine these with NSAIDs or H. pylori, and you're on a dangerous path. But the worst part? You won't always know it's happening. Some people have ulcers for months or years without severe symptoms. That's what makes this condition so dangerous. It creeps in quietly and then explodes without warning. You may only notice mild bloating, or that you feel full too quickly, or a little nausea after meals. And that's when people shrug it off and say, it's probably nothing. But sometimes that nothing turns into bleeding, or a hole in the stomach, or an infection that spreads through your body. In the next part, we'll talk about exactly how to recognize these silent signals before they become a health emergency. When your body speaks, recognizing the warning signs of ulcers. The human body is incredibly intelligent. It whispers first, then speaks louder, and if ignored, it screams. When it comes to ulcers, the problem is that many of us aren't listening until it's too late. So let's be clear, ulcers do have warning signs, but they often mimic less serious conditions like indigestion or gas. That's why people delay getting help until a condition has progressed dangerously. Let's start with the most common sign, burning stomach pain. This isn't your typical cramp. It's a gnawing, persistent ache in the upper abdomen, often felt between meals or during the night. Sometimes eating helps. Sometimes it makes it worse. For duodenal ulcers, the ones that form in the upper small intestine, pain usually comes a few hours after eating and is relieved by food. For gastric ulcers, which are in the stomach itself, the pain can worsen with eating. This pattern can confuse people into thinking it's just hunger or acid reflux. But ulcers can also show up in other ways. Bloating, frequent burping, loss of appetite, unexplained weight loss, mild nausea, fatigue from slow internal bleeding. Let me paint a more serious picture. Suppose you start vomiting, and it looks like coffee grounds. That's digested blood. Or your stool turns dark, tar-like, and sticky. That's a red flag. Your ulcer may be bleeding internally. This is not a moment for home remedies or guesswork. It's an emergency. And then there's the most chilling sign of all, sudden, severe abdominal pain that spreads across your belly. This could mean the ulcer has perforated, punched a hole in your stomach wall. What follows is a flood of stomach acid and food into your abdominal cavity. triggering a life-threatening infection called peritonitis. This pain is not something you can ignore. It's a full-body shutdown. People collapse. They go into shock. They need emergency surgery within hours to survive. So, why do so many people miss the signs? Because they misdiagnose themselves. They think it's something they ate. They buy antacids. They wait. But here's the truth. Ulcers don't just go away. Without treatment, they get worse. They grow. They bleed. They break through. Let's talk about diagnosis. Because if you catch it early, you can stop the damage before it's irreversible. Doctors have several ways to detect ulcers, but the most reliable is an upper endoscopy. A tiny camera is passed through your mouth into your stomach and small intestine. This allows doctors to see the ulcer directly, take tissue samples, and even test for H. pylori or cancer. There are also non-invasive tests. Urea breath test for detecting H. pylori. Stool antigen test. Blood test for antibodies. These can confirm infection, but they don't show the physical damage. That's why endoscopy is essential if symptoms are serious or if complications are suspected. And don't forget your medication history. If you're using NSAIDs regularly, even just for arthritis, headaches, or sports injuries, tell your doctor. It changes the risk profile and the treatment plan dramatically. Many people use painkillers for years without realizing they're slowly damaging their stomach. It's only when they collapse from blood loss or need emergency surgery that the dots are connected. By then, it's a long and difficult road back to health. This isn't about living in fear. It's about listening, about taking symptoms seriously, because the body speaks. It always does. In the next section, we'll explore how ulcers are treated and how lifestyle changes can ensure they never return. How to treat and prevent ulcers for good. If you've made it this far, you already understand one critical truth. Ulcers are dangerous, but they are also treatable and in most cases preventable. But treatment isn't just about calming the pain. It's about identifying the cause, stopping the damage, healing the wound, and most importantly, making sure it doesn't come back. Let's start with medical treatment. If your ulcer is caused by the H. pylori bacterium, and many are, your doctor will likely prescribe what's called triple therapy or quadruple therapy. 2 antibiotics to kill the bacteria. A proton pump inhibitor, PPI, like omeprazole or lansoprazole to reduce acid. Sometimes bismuth compounds to protect the stomach lining. The antibiotics usually last 1 to 2 weeks. The acid reducers, often several weeks longer. This approach can completely heal the ulcer and eliminate the infection in most cases. If H. pylori isn't the cause, and you've been using NSAIDs, then stopping the medication is essential. But don't stop abruptly without consulting your doctor, especially if you rely on them for arthritis or chronic pain. You may need a safer alternative like acetaminophen, or you might be prescribed cytoprotective drugs such as misoprostol, helps restore the stomach's defenses. Sucralfate coats the ulcer, forming a protective barrier. H2 blockers, like ranitidine or famotidine, though PPIs are often stronger and preferred. Now here's what a lot of people don't realize. Healing an ulcer isn't just about pills. It's about changing your terrain, your habits, your diet, and your mindset. So let's talk lifestyle. 1. Stop smoking. Nicotine constricts blood vessels and slows healing. It also increases stomach acid and weakens your digestive lining. If you want your stomach to heal, cigarettes must go. 2. Limit alcohol. Even moderate drinking can irritate the stomach lining, especially when combined with stress or NSAIDs. Heavy drinkers are at far higher risk of complications. 3. Eat smart. Avoid trigger foods, spicy dishes, fried foods, caffeine, and citrus. Eat smaller, more frequent meals instead of 3 large ones. Choose bland, healing options, bananas, oatmeal, boiled rice, and steamed vegetables. 4. Manage stress. Stress may not directly cause ulcers, but it increases acid production, disrupts digestion, and worsens inflammation. Techniques like breathing exercises, therapy, and meditation can make a big difference. 5. Be cautious with painkillers. If you have to take NSAIDs, use the lowest effective dose. Take them with food and ask your doctor about protective agents. Don't self-medicate indefinitely. 6. Follow through. Finish your medications even if you feel better. Follow up with your doctor. Get retested if necessary. Many people stop treatment early, and the ulcer returns stronger than before. Here's the truth. Modern medicine has made ulcers easier to treat than ever, but people still die from them. Why? Because they wait too long. They ignore the symptoms. They rely on over-the-counter solutions instead of getting real help. Or they go back to old habits once the pain is gone. But you don't have to be that person. Ulcers are not a sign of weakness. They're a signal, a call to care for your body more attentively. A reminder that what's happening inside matters just as much as what shows on the outside. A call to action for you and the ones you love. So here's what I want you to do. Right now, if you've experienced stomach pain that keeps coming back, if you take NSAIDs regularly, if you've noticed dark stools, nausea, or unexplained fatigue, if you smoke, drink, or live under chronic stress, talk to your doctor. Ask about ulcers. Ask about H. pylori. Request the tests. Take action before you find yourself in an ER with a condition that could have been stopped weeks or years ago. And if you're watching this thinking, this isn't me, then share this video with someone who might be ignoring the signs. A friend, a parent, a co-worker. You could be the reason they get the help they need. At Gold Zenith Heath, our mission is simple. Bring the truth to light. Help you live longer, stronger, and smarter. Because knowledge saves lives. And now you have it. Please, don't forget to like, comment, and subscribe. Turn on the bell icon so you never miss a life-saving video like this one. And most importantly, take care of yourself. Your health is your foundation. This has been Gold Zenith Heath. Stay informed, stay protected, and as always, stay well.